Today we'll be discussing about the cracker burns, which are very commonly seen, especially around this festival. These burns are very commonly seen in India, and especially around the festival of Diwali. A few days before that, and after a few days after, there's a sudden spurt in the cases. According to one study, the extent is almost 7 cases per 1 lakh of population. So that's a huge extent. Luckily, most of these cases are minor burns with the involvement of less than 5% of body area. So that is one good thing, but otherwise it's a serious problem. The burns are flash burns. When there is a sudden flash in the cracker, the person trying to explode the cracker gets hurt with that. So there are flash burns mainly involving the hands, upper limbs, and the face. But at times when there is a frank fire which breaks up because of the clothing getting fire, so there are flame burns and there can be inhalational burns also. And then when one other very typical type which is seen only with cracker burns and not with seen with other types of burns is the blast injuries. Most of these people, when they are trying to burst the crackers, they try to hold it in their hand while lighting the cracker. And suddenly the cracker bursts in their hand. So the hand gets badly damaged because of the blast effect. So these are the three kinds of injuries which are commonly seen. And most of these patients who are involved in cracker burns are young children, mainly adults and boys and young adults who try to be very adventurous during the festival season. And during that time, they get injured with it. So once we see that someone has got cracker burns, there are certain measures that are to be taken at home. The first thing is to rescue the patient, and if there is a fire that breaks out, to put out the fire. And then we can see if there are no open wounds. Immediately, in case of flash burns, immediately we need to wash that area with ice cold water and maybe dip that area in cold water for some time, 10, 15, 20 minutes, till that burning sensation subsides. What happens is, if this is done as soon as the incident happens, this limits the thermal damage to the tissues. So the extent of injury is controlled very much, and the person may not need any further treatment because of with this measure. But if there are any open blisters or any blister formation is there, or there is any open wound, or there's some visible skin damage, then no time should be wasted in such measures, and immediately the person should be brought to a hospital or to a doctor for further treatment.
Right. Thank you for answering that, doctor. So what is your approach to the patient with cracker burn injuries?
Once these patients, you can put the next slide.
Yeah, doctor.
Once these patients they are brought to the hospital, the first thing is to and the same basic life support like the airway, the breathing and the circulation, which is general in all the patients of trauma. And once that is taken care of, we take a detailed history of the incidents and any history of other comorbidities, any history of intoxication, history of any drug intake which is there. And then we examine the patient as a whole, look for any associated injury. What happens is that obviously the part which is burnt or which has had suffered a blast injury is most visible part, and all of the attention gets concentrated on that area. And in that case, if the patient after the incidence has fallen down from some height, or there has been some other injury like abdominal or chest injury, that may be missed. So we have to first examine the patient as a whole, and then we turn our attention to the injured part, the area of burns and the extent of burns. The management will depend upon that. Any presence of any open wounds or fractures is noticed. And then in these cases, as in most of other plain burn cases, we also have to focus our attention upon the status of the circulation, the blood circulation in the injured part, especially if the hand is injured, then all the digits we need to examine if all of them have good blood circulation. And then other thing is in the limbs, we have to look for any constriction band. Sometimes if we have, especially we are wearing synthetic clothes with fire or with heat, they will form a tight band around the limb, which may jeopardize the circulation to the limb. And other thing is once there are circumferential burns, the burnt skin it becomes a very tight scar, and that may start compromising the circulation. So if anything of that sort is there, then we need to release that tight band, and so that the circulation is not impaired. These are the emergency measures, and then the patient is obviously put on this fluid management, painkillers and antibiotics. All those things are done. Another important thing in these cases which may be missed is the presence of inhalation burns. What happens is if a fire breaks out after the cracker burst, uh, the person who gets caught in the fire may suffer inhalation injury, may breathe in smoke, and there because of that there can be burns in the respiratory tract, in the mouth, in the nose. So that also we have to be careful, because that can be at times a life-threatening condition. So that also we need to take care and manage accordingly. We need the wounds to heal without getting infected and in the shortest possible time. So if there are partial thickness burns, most of the wounds, they will heal with normal dressings. And our aim is only to keep them clean and give prophylactic antibiotics so that they don't get infected and become full thickness wounds. Second thing is, if there are any open wounds, we need to properly debride them, because most of these blast injury wounds, they will have gunpowder and other particles embedded in the wound. So we need to debride them, take them to the operation theater and debride them properly so that they heal without getting infected. And here we need to cover the wounds as soon as possible. What happens is most of the cases, especially if the wounds are deep wounds, the burns are deep burns, most of the times people, they try to heal the wounds with dressings only, and not opt for wound coverage with skin grafting or any other reconstructive surgery. So these things will lead to deformities in a long term. Our aim is to heal the wounds in a proper way so that the long-term deformities are not there. The contracture formation can be prevented and the functional restoration is established as soon as possible. Another thing is regarding the negative pressure wound therapy. Nowadays, this is being used more and more frequently. So this is indicated in cases where there's gross contamination and there's revitalization of the tissues. We are not sure about the survival of the tissues in the beginning. So in that case, we apply negative pressure wound therapy so that the wounds, before we do a definitive coverage to the wound should be healthy and without any active infection, as well as without any dead tissue in the wound. So that is where the negative wound therapy will also come in play during that. Most of the times the negative pressure wound therapy is, as I said, is indicated in those cases where there is like gross contamination of the wound and there are dead tissues in the wound, where we are not sure that if we cover the wound right now, it will not get infected. So during that temporary period, we cover the wound with negative pressure wound therapy so that we can, once the wound is healthy, granulating, we can do a definitive coverage. If you go deeply into the incidents, most of the times there's some kind of carelessness involved on the part of the person who is bursting the crackers, resulting into these injuries. So there are certain measures which we need to take care. One thing is the children, as far as possible, they should be allowed to burst the crackers only under the supervision of the adults. They should not be left alone to play with the crackers. And nobody should try to burst the crackers while holding them in their hands. You should also always try to maintain a safe distance between the cracker and the person trying to burst the cracker, so that in case there is some unexpected explosion in the cracker, still if the distance is there, the injuries will not be those that severe, or there may not be any injuries at all. A third thing is, especially in cases where these atishbaji, the crackers which fly in the air and then get burst, we should be very careful about the positioning of the atishbaji before lightning it. If we do it very carelessly, it will go in any direction and hit some bystanders, or maybe go into some other house and cause fire over there. Then another important measure is always keep a bucket full of water nearby whenever you are bursting the cracker, so that if there is some unexpected small fire or some unexpected incidents, these things will come handy to put out the fire and limit the damage. So I think if we are a little more careful about these things, the cracker burns can be prevented to a large extent.